Hello everyone, thank you so much for having me here. Hopefully I can provide you with some useful information to take home today. So I really enjoy working in the field of exercise oncology. I get to work with ordinary people going through something quite extraordinary, and when I get to make a difference in their lives, that's pretty special to me. There's so much really overwhelming evidence for all different types of cancers these days that exercise is beneficial. And it should be a part of everyone's cancer treatment. Today I'm going to go over a few different things: benefits of exercise, the main issues for people with leukemia, treatment side effects, exercise considerations, so what do we need to consider when prescribing an exercise plan for somebody with cancer, deconditioning and fatigue, as I know that's a main problem for you folks with blood cancers, exercise guidelines, how much, what should I be doing, intensity, how hard should I be working. We're going to do a little bit of exercise towards the end and rate your strength and your balance, so get ready for that. And a few tips on how to get started. Questions, of course, are welcome all the way through. So this is our lovely flyer, and you'll see this on the front desk as well. So there's just a few of the benefits of exercise listed there for you to have a look at. So can I get a show of hands? Is anybody exercising regularly at the moment? You go exercise each week. Great. Great. Is there anybody that was exercising prior to diagnosis that is no longer exercising? Okay, yep. And anybody that was exercising before is exercising now, that still exercises at the same level as they did before diagnosis? Okay, so a few of you, yeah, yeah. So it's so important to continue your exercise for lots of different reasons. You know, you can see the benefits there in terms of making just general physical functioning in life easier, improving strength, aerobic capacity, managing mood and fatigue, and all sorts of lovely things like that. There's also a little bit of evidence that's come out more recently about sleep quality improving with aerobic exercise, so things like walking and cycling and swimming fall into that category when you're coming up to about 50 minutes or an hour of that activity. So it is a little while. I think what happens a lot of the time is a diagnosis can make you feel really out of control of what's going on, and exercise is one way that you can kind of take a bit of power back, which is really nice. We have quite a bit of evidence around hematological or blood cancers generally. There was a study done by Bergenthal in 2014 that showed that for people who had blood cancers, including CLL, their quality of life improved, their physical functioning improved, there was less reported depression, and improved fatigue levels for these folks that were doing some exercise. So quality of life's a really interesting one, and I'd like you to take a minute to think about what that might mean to you. It might be being able to manage to do your grocery shopping without getting too tired and having to take a rest. It might be running around with your children or your grandchildren. It might be traveling. It could be anything. But I think it's so important to know that what you're working towards and what you're wanting to get out of your exercise and what's important to you. So there was some other studies as well, one done by Kruger in 2016 that looked at immune function and that exercise would improve that. But the dosage was really important. So they showed that regular moderate exercise training, moderate intensity, increased immune function. You know, you're less likely to get sick, less likely to have infections, blood counts were better in these people. What also was shown, though, was that acute high-intensity bouts of exercise temporarily decreased immune function before it would bump back up. So, you know, the intensity of your exercise is really quite important depending on what your blood count's looking like and where you are in your sort of course of treatment, or whether indeed you are watching and waiting, to make sure that you get the most out of your exercise, but don't put yourself at additional risk either. There was another study which I know it's unlikely for somebody with CLL to have a stem cell transplant. That's not usually a common form of treatment. However, the important thing shown in this study, I think, is that even a little bit of exercise goes a long way. So these folks went into hospital to have a bone marrow transplant that was allogenic, so it was from a donor. 18 of the patients did bed exercises that were supervised for half an hour each day, and 17 had usual care, so they didn't do any structured exercise. In the exercise group, the lymphocyte cells, their immune function actually went up by 40.9. The control group that were doing no exercise, their lymphocyte cell drop was 640.7, so that's quite significant that they were able to see that change. There is also a little bit of research to show that there's a reduced risk of relapse of leukemias in people whose lymphocyte cell and their immune function stays high and they stay well, especially post this kind of treatment. Yeah, so a little goes a long way. The other thing that's really important is that the exercise is specific to you. So there's lots of places on the internet where you can get nice generalized programs and a little bit of information, which is okay if you're not managing a chronic condition. But once you factor that in, and maybe any other comorbidities that you might have, so you might have a heart condition, you might have diabetes, some joint pain, low bone density, and they need to be taken into account when choosing the right exercises for you. Also, of course, how the leukemia has affected you, how your treatment for leukemia has affected you, if indeed you have had treatment, your goals as well. So there's no good you doing exercise that does not push you towards the things that you want to be able to do and need to be able to do. If it's not specific to you, I think that that's not so helpful. Also, what you enjoy. If you hate swimming, don't go swimming. If you set yourself up and think, right, I'm going to go 3 times a week, it's going to be great, I'm going to swim and I'm going to get fitter, and you really, really dislike swimming, it's not useful to you, it's not practical, and you're not going to do it. So there's got to be some level on which you enjoy the exercise. You don't have to love every second of it, because most of us don't, let's be real. But if it's something that you kind of like doing on some level, something that's practical for you, that's really important. Whether that's walking with a friend or attending a class, or even possibly playing a sport, it needs to be enjoyable on some level, I think. And of course, the exercise program will be tailored to you in all of these ways and more. If you're during treatment versus just post-treatment, or not having had treatment at all, the exercise that will be appropriate to you will be different. And of course, your previous fitness level and your current fitness level. Somebody that's quite fit already and is doing a bit of exercise, they will be given something different than someone who is just starting out. So the common effects of leukemia that seem to particularly affect physical functioning that we see a lot, fatigue is one of the major ones, as well as anemia, so low red blood cell count can make you feel tired, dizzy and short of breath with not much activity at all. It's really easy to get an infection, and if you knock yourself, it's very easy to bleed or to bruise. And these things all need to be considered when you're being provided with an exercise program. Your treatment may increase the risk of some conditions, like steroids and chemotherapies, and some other therapies can increase the risk of bones thinning and osteoporosis. And if you're feeling tired and dizzy because you're anemic, then that may make it very easy for you to fall. Which means that exercises that guard against you falling, things like balance exercises and exercise to improve your strength and your immune function, are going to be really useful. It's also important that you avoid infection, so that might mean at particular times it's not appropriate for you to go to public pools or even to public gyms if your red blood cell count is particularly low. The side effects of the treatments themselves is something else that needs to be taken into account. So fatigue is a big one that I've already brought up, low blood count as well, things with balance, muscle mass, heart problems, aches and pains, chemo brain, deconditioning, may all take effect and all need to be considered when you are starting an exercise program. But the great news is that most of them will benefit from exercise. Most of them will affect you and bother you less if you keep yourself fit and well through the right sorts of exercise. So I'm going to talk a little bit more about fatigue, because I think that it's quite a relevant side effect of both the cancer and the cancer treatment. So it's the most reported side effect, the most reported problem. I would say that comes through our door. It would be more than half if not up to 3/4 of the folks that we see that are affected by fatigue. And this is a fatigue that is not the same as just having a long day at work and being tired, or just having had a poor night's sleep. It's something that persists. It's something that can hit you like a ton of bricks. And it's something that is usually not improved much with rest. It's the kind of thing that can really get in the way of your day-to-day functioning, and is usually not well related to what you've done in that day. So you might have had a really light day of activity and feel really, really tired. So it usually doesn't have a good relationship. What is great though is that the overwhelming evidence we have now is that cancer-related fatigue is not really improved with rest. And I'll show you why in a minute. It's actually improved with exercise, which I know sounds a little bit counterintuitive, but bear with me. So I know that's a little bit pixelated, but there's lots of factors that contribute to cancer-related fatigue. It's not just your treatments, and it's not just the cancer itself, but it can be things like poor nutrition or poor sleep or stress, or problems with your blood count. So a lot of these things can be helped with exercise, but it's important that if it's something that you're really struggling with, that you go and see your care team about. There was a landmark study done by Cornea in 2014 that tested people's cardiovascular or aerobic fitness before they started chemotherapy for 12 weeks, and then tested it after, and they found that chemotherapy for 12 weeks was the equivalent of a decade of aging or decline on the cardiovascular system. So it's kind of like you've just gotten old really, really fast, and it can be really quite distressing to people. So when you combine, drug toxicities, bed rest that you might require because you don't feel well, normal aging, lack of activity, and other treatments, it's kind of this perfect storm of deconditioning and feeling physically like you can't do the things you want to do. Lots and lots of people with cancer are not sufficiently active. They're not meeting the recommended guidelines of even minimum activity, and of course that needs to be adjusted depending on your situation, but it's leading to a deconditioning of all these systems, the cardiovascular system, respiratory, musculoskeletal, they're all affected. But like I've said, the really good news is that exercise prevents and reverses this process. It's never too late to have a positive effect from exercise because you've started. The studies that come out about cancer-related fatigue really show over and over again that the people that are most affected by fatigue benefit the most from exercise. They seem to see the greatest improvements, I suppose you could say. So it's important to break the cycle that it's really easy to get stuck in. So you'll be fatigued, you'll feel tired from treatment or from the cancer itself, so you'll rest. And if you rest for long periods of time, you become deconditioned. Body doesn't work as well, it's weaker. You're less fit, it's harder to move around, harder to do the things that you need to and want to do. You're less active as a result, and the cycle continues. So breaking that cycle down is really, really important. So there's lots of different ways that fatigue can be managed, and I'll talk about the specifics of exercise in a minute. But it's important to be realistic about what you set yourself up to do. If you set yourself up to do an hour of exercise every day and you don't do anything at the moment, you're going to find you crash. You're going to do that for a few days and feel really great, and then you're going to have to take 3 or 4 days off to kind of recover from what you tried to do. So realistic is really important. Pacing your day and pacing your week. So spreading out your activities is important too. Trying not to back up activity after activity across your day without breaks. Exercising when you feel least fatigued. So you might feel really good from about 10 till 12 in the morning, or you might feel great from 3 until 5 o'clock in the evening. Pick the best time for you. Be smart about that, and try to pick activity that you like as well, as much as you can help eating well and sleeping regularly. And while we've still got a bit of sunshine, trying to get out in the sunshine and with friends and with family wherever you can. So what are the guidelines? So as they still stand, even though they've just been updated in the last month or two, the recommendations that are going to be handed down from ACSM are coming, because the last time it was done was 2010, but Exercise and Sport Science Australia have put together their new document about their recommendations. And this is still kind of where they land. So for cardiovascular exercise, so that might be swimming, it might be cycling, it might be walking, those sorts of things. The recommendation is that you try and fit in half an hour a day, at least 5 days a week. So that adds up to 150 minutes, and we're talking moderate intensity, remembering that immune function is actually improved by moderate intensity, temporarily dropped off by vigorous or high intensity activity. So for somebody that's not doing any exercise at the moment, that seems really big, but even 5-minute blocks of exercise, even a minute of something, will help you improve and help you build that up. So there's no reason why you need to start with half an hour. I wouldn't recommend it, but 5 minutes might be somewhere where you can begin. For people that are exercising more regularly and are a little bit fitter, you can also engage in vigorous exercise if your blood counts are really good and you're not in treatment, and that allows for a shorter amount of time of activity. So 75 minutes is what's recommended rather than 150. I think the key with most of this is start low, progress slow, build yourself up gradually. One of the other parts of exercise that's very important that often gets forgotten is strength training. Or resistance exercise, it might be called sometimes. So your resistance exercise is a really important component of your physical function as well, because it gives you the strength to do the tasks that you need to do, keeping your muscles and bones strong. So if you have problems with low bone density, or you're finding yourself weak and it's difficult to do the tasks that you need to do, your strength training is something that can really help with that. Starting with one set of 10 to 12 repetitions of, say, 8 exercises is a really good place to begin. That might take you 8 to 10 minutes, and you'd be done twice a week and see some improvement even with that. And it doesn't even need to be external resistance. So you can see the lovely lady in the corner is holding some dumbbells. So it can mean dumbbells, machines, bands, but it can also mean your body weight resistance. Things like sitting and standing out of a chair or some push-ups on the wall can even be really useful if you're not currently, if you don't currently have any equipment at home and you're just wanting to make a start. So we talked a little bit about intensity. So let's explore that a little bit. The two main ways that we can measure intensity are through heart rate and rating of perceived exertion. So rating of perceived exertion is how hard you feel you're working. It sounds a little bit wishy-washy and very subjective, but all the data that we have that looks at comparing heart rate to how hard somebody feels they're working, they're really quite linked together. You actually have a much better idea of how hard you feel you're working than you think you do. So light intensity is sort of where you could sing quite comfortably and you're not going to get out of breath. Moderate intensity, you could talk to somebody, but you probably couldn't sing. It might include activities like walking or biking. And vigorous intensity, you can't hold a conversation anymore, and it might involve things like jogging or tennis or very vigorous swimming. So what I'd like you to do is take 2 fingers to your wrist, where your thumb, on your thumb side, okay? So thumbs up, fingers on. I'm going to be quiet for a minute. I want you to try and find your pulse, okay? See if you can find it there. Okay. Now, I'm going to count 15 seconds. I want you to count the beats. Ready? Go. And stop. Okay, so if you take that number and you times it by 4, you get your resting heart rate. For most people, it's probably between about 60 and 80. It can be up to 100 and still be classified as normal. If you're on chemotherapy or you're within 3 months of having had chemotherapy, your heart rate might be higher than that, and that's okay. If you're on any medication for your heart, like beta blockers, your heart rate might be lower than that. Or if you're a triathlete, so you know, your heart rate might be lower too. So that is one way to measure your effort. But that can be hard to do. Some people in here might have smart watches where you can have a look at your heart rate periodically, and that's useful as well. Yeah, the other way, as I said before, is the rating of perceived exertion, Borg's scale. So as what you're doing now, sitting down, is a 6 on this scale. So the logic of the scale was that if you put a 0 after the end of any of the numbers, that's the heart rate you'd be at, which doesn't quite work perfectly, but it gives us an idea. So we talked about moderate intensity before. That would fall in that 12 to 14 scale, so somewhat hard. You feel like you're doing something, but you can sustain it for a while. And vigorous intensity is that 15 to 18 range, so that hard to very hard zone, where you'd find it hard to hold a conversation and you feel like you're working quite hard. Okay. We're going to do a little bit of exercise now. So this is going to be a little bit fun and interesting because usually when I do these things, people are sitting in chairs where the bottoms of them don't fold up. So we're going to make our best of it. We're going to do a 30-second sit to stand. So this is a measurement that we hand out a lot. When we see somebody first, we have a conversation about their health history and their goals. And all those sorts of things, their treatment pathways, what have you. But we also look at their physical functioning. So we will test their strength, their aerobic capacity, their balance, all of these things. And these are some ways that we do it. So 30-second sit to stand, we're all going to have a go at. But I want you to be mindful that you're just going to tap your bottom down on the top of the chair rather than be able to sit down because the chairs move. So I'm going to get you all to stand up. Okay, make sure you've got enough room. Okay, feet hip width apart, hands across your chest. Okay, you're going to tap your bottom down or squat down and come back up. Good. So normally we would sit all the way down. We're not going to be able to do that today. That's okay. So the idea of this test is that you're going to do as many as you can, but safely. I'm going to give you 30 seconds. I'd like you to count how many you manage, and then I'm going to show you a chart that tells you all about how well we would expect you to do, right? Okay, so ready, go. Counting your repetitions. Good. It's going to feel like a really long 30 seconds, but that's okay. Yep, you still with me? Good. Okay, and stop. Okay, so how many did we anticipate you should be able to do? So you can see the top row is women, the bottom row is men, and then we've got age brackets across there. So have a look for your age bracket if it's there. There's another test we do for folks that are under 60 where they squat and they don't sit down in the chair, which is kind of what you did today. So you probably did something that was harder. But yeah, did anybody meet the requirements? Yeah, great, that's fantastic. Okay, we're also going to have a look at your balance. Now be mindful and be safe about this. If you don't feel comfortable doing it, that's okay. But we're going to have a go standing on one leg. So the rules for this are hands on hips. You're going to lift your leg to balance, and the lifted leg cannot come into contact with your supporting leg, okay? So I'm going to time, I'll tell you in 5-second increments where we're up to, all the way to a minute. I want you to stand for as long as you can. Ready? Go. So that's 5 seconds. 10. 15. 20, 25, 30, 35, 40, careful. We up to 50? I got distracted. Yeah? 55? Longest minute ever? And 60. Okay, anybody make it to the end? Nice, very good. So you can see up there kind of what we'd recommend you be able to get to. So there's been lots of data put together, and that's what the average person can do. So of course, if you're somebody that's going through treatment or is affected by cancer, these might seem like lofty goals. But like with everything else, the idea is to try and avoid inactivity and just move a little more each day. Move in these directions. They don't need to be the thing that you hang on to and be upset with yourself if you can't do. But they're a direction to move in and something to work towards. Okay, so some other exercise tips. Generally speaking, something is better than nothing, like I've been saying all the way through. Start low, progress slow, set realistic goals. You can use a pedometer to establish how much activity you do in a day. If you have an iPhone within your health app, it will count your steps. So you can look at that and record it and use it to motivate yourself to move a little more. Balance and flexibility exercises are something that's quite easy to tuck into your day and doesn't take up too much energy. So even if you're not feeling like you can do much else, that can be a good place to go. Something you enjoy, something with a friend, and also, you need recovery as well. You need rest time. Can't be exercising all day long. Make sure you build that in. Okay, so where to start? This is just an example, and this might not be where you are, but hopefully it will give you an idea. So you might walk 15 minutes every second day at a comfortable speed, so that moderate intensity, right? And then every 2 to 3 weeks, you might up the duration by 20% until you can do half an hour. So that would be a good realistic way to build that up. Duration first. Then, and I know there's something incorrect in this, but you want to increase the frequency. So you might walk each day and then slowly build that up. So you're adding in a little bit more, so you're walking every day, build up the amount of time that you're walking. And that can be applicable to, to most activities, doesn't have to be walking. The third thing to do is to increase your intensity, so how hard you feel you're working. That might be in the form of quick bursts of walking faster or introducing some hills into your walk. Some of you might not have that choice where you live. You might step outside and it's hilly anyway. But yeah, there are some ways that you can make your exercise gradually more difficult in some practical ways. It's important to be prepared for situations of tolerance changing. So you might find that your tolerance for exercise changes day to day or even hour to hour, depending on how well you are. And it's good to have contingency plans, something for a good day where you feel relatively well, something for a slow day where you're not feeling so fab, and maybe even something for a no-way day. You might have some no-way days, say post-chemotherapy, if that's a treatment that you're going through, or if you have an infection, that might be a reason to have a total rest from activity. Gentle stretching and exercises lying down still count. There's still activity, there's still movement, it's still beneficial. Seated exercises are the same. Okay, so there are a couple of reasons why you might want to stop exercising once you've started and seek some further support. So if you're really short of breath at rest, it's not that you've been power walking for 20 minutes and now you're feeling a little bit out of breath because you're working hard, but it's kind of come on while you're not doing a whole lot. Things like sudden pain, sudden nausea, a fever, or an active infection, your blood counts being very low. They're the kinds of reasons why you might need to take a break from exercise and may need to check in with your GP or your care team. Okay, so we're going to do a little bit of exercise now. So a chair squat with a chest opener. So this is a little bit more involved than the test we did before. I'd like you to take your hands in front of you. You're going to come down and tap your bottom on your chair, stand up and open those arms. Make sure you watch out for your neighbour. Yeah, good, good. So often as people get better at exercises like these, we'll add a band, a resistance band, let the arms work a little bit harder. There's always ways we can make an exercise harder or easier to make it right for you. Beautiful, that's great. You can have a seat, triceps extension. So I'd like you to take your arms up overhead, raise them high, take your hands behind your head, elbows still up, and raise. Good. So this is the back of the upper arm, the triceps that's working here. And again, this is something that can have weight to it. You could have a band to it to make it harder if you needed it to be. Now let's bring it down by your sides for some bicep curls. So we bend the elbows and straighten them out again. Again, you could take little cans out of your kitchen, water bottles, or even a band if you've got something like that lying around at home. Yeah, great. And to finish off, we're going to do a hamstring stretch. So I'd like you to take one foot out in front of you. You might need to sit to the front edge of your chair. You might need to wiggle forward with a straight leg. You're going to slide down and stretch the back of the leg there, leaning. Everybody's situation is going to be different. And like we've talked about, pre-existing conditions, other health concerns that you might be managing, the treatment that you have, where you're up to with your CLL. And the exercise program needs to be tailored to that. It needs to be specific to that so that you get the most out of it with the least risk. That's why it's really important to see somebody qualified. Go and see an accredited exercise physiologist. So an exercise physiologist is somebody that is really well versed in chronic health management through exercise. So we all do a master's degree in clinical exercise physiology, and then there are some folks out here like my colleague and I who've done a little bit of extra training in oncology too, and that might even be better still. But somebody that can understand your condition and the challenges that are around it and what you want to get out of your exercise and what's important to you. Yeah, like I said before, it can feel a lot like a lot is out of your control, and exercise is something where you can take a little bit of that control back, and it has physical benefits, psychological benefits, and benefits to those that you care about as well. It's been wonderful speaking with you. Thank you so much.